Morning, everybody. Welcome to Medicare Open Enrollment. This sounds really loud to me. I don't know how it sounds to you. Okay. My name is Judy Minardi. I'm one of the Shine counselors here at the Jenks Center. And this year we're very lucky because we have actually 3 Shine counselors here. 2 are here today. The other 2 are here, Pat Bailu and Sumner Blount, our other counselors here this year. And we also have a Shine counselor emeritus who does not want to be introduced, but he's with us also here today. Before I start, I just wanted a show of hands. Is everybody here on Medicare already? Okay, so everybody has Medicare. So this is good because this program is for what kinds of things you can do during Medicare open enrollment. So I'll start. The first slide talks a little bit about the Shine program. And those of us who are Shine counselors are volunteers. We have been trained by the State Office of Elder Affairs in various aspects of Medicare. And our job is to give you unbiased information about Medicare insurance and health plan counseling. I thought before I get into the wheres and how-fors or whatever of Medicare, I would go over a bit with you what your Medicare coverage choices are. So to talk a little bit about that, you have Medicare, as you probably know, and in your folders you have a green sheet that talks about Medicare Part A and Part B. And Medicare doesn't cover everything. So as a quick summary, Part A of Medicare covers in-hospital benefits. So if you are hospitalized overnight in the hospital, that would be covered under Part A of Medicare. There is a deductible for that, though. And the deductible is $1,600 per benefit period. I won't get into the weeds too much, but Medicare will define a benefit period as beginning with the first 90 days that you're in the hospital. So you could be in and out of the hospital a number of times in that 90 days and have one deductible. If then you are out of the hospital for 60 days and did not have hospitalization or skilled nursing treatment and then went back into the hospital, that would be a new 90-day benefit period. So conceivably, one could have more than one deductible in a calendar year. If you have been overnight in the hospital for three nights and then are transferred to a skilled nursing facility, rehab, that kind of thing, Medicare covers days 1 through 20 for that. Days 21 through 100, the cost per day would be $200 per day. On the other side of the sheet, you see the benefits for Medicare Part B. And this covers all your other doctor's bills, physician's visits, surgeons, outpatient surgery, diagnostic tests, that sort of thing. Medicare covers 80% of those bills. You pay 20% of Medicare's approved amount. There is a calendar year deductible for these benefits, and that's $226 per calendar year. Medicare Part A is free to you. Medicare Part B you pay for. And in 2023, that's actually going down a little bit, and it will be $164.90 a month is the standard rate. People at higher income levels will pay more than that for Medicare. So because Medicare doesn't cover everything, people look at, are there ways that I can supplement my Medicare coverage? So what they might be looking at, way one that you can do it is through what's often referred to as original Medicare, or sometimes people call it traditional Medicare. I remember that the counselor emeritus here, whom I used to go to his presentations, used to say, all right, you're not listening to me, used to say, there's all kinds of terminology in Medicare, and a lot of it's redundant, so I'm going to try to work it through a little bit, what its different meanings are. Um, but with original Medicare, you would have, of course, Part A and Part B of Medicare. Medicare does not cover outpatient prescription drugs. So therefore, you would need to purchase a Part D Medicare prescription drug plan. You could also add what's called a Medigap plan. And the Medigap plan would cover I look at it as covering the financial gaps in Medicare. So Medicare has to cover the service, then the plan will cover the financial gap. So depending upon which Medigap plan you have, it might cover that $1,600 inpatient hospital deductible. It might cover the Part B deductible, that 200 and, can't remember what it is anymore, 226, thank you. And it would cover the 20% that you have to pay for all your other services. The Medigap plans, you will see, are outlined on your blue sheet. It says Massachusetts Medigap plans. And we'll talk about all these a little bit more. This is just to give you kind of an overview of the different plans. So now on the other side of the other option is, this is Part C of Medicare. And these are the Medicare Advantage plans. Again, this is where we get into a lot of terminology. Medicare Advantage, Part C of Medicare, Medicare HMOs, Medicare PPOs. Sometimes doctors' offices will refer to them as Medicare replacement plans. For these plans, again, you have to be enrolled in Part A and in Part B of Medicare. These plans will cover your Part D, your Medicare prescription drug plan is covered by these plans. And these plans will have co-pays, but they'll pay they'll cover your services, and you may have to pay a co-pay for them. The co-pays vary. It might be $10 to see a primary care, $50 to see a specialist. You'll most likely have a co-pay when you're in the hospital with these kinds of plans. And we can talk about that more as we go along, too. People sometimes get confused, and they'll say to me, Judy, I have Part A and Part D, but I don't have I have Part A, Part B, and Part D, but I don't have Part C. That's okay, because you want Part A, B, and D, or Part A, B, and C. So talking just quickly about a comparison between the Medigap plans and the Medicare Advantage plans. First of all, with the Medigap plans, and they've used in this slide, they're using one of the, or two or three designs for Medigap plans. But with the Medigap plans, remember that the service must be covered by Medicare. And as long as the service is covered by Medicare, the Medigap plan pays the remaining amount. Medigap plans often will have higher premiums than some of the Medicare Advantage plans. But with a Medigap plan, you can go to any doctor who accepts Medicare. You don't have to choose a primary care provider. The primary care provider does not need to make your referrals to specialists. Now, if you have a primary care provider now and you switch to a Medigap plan, 10 to 1, that primary care provider will take the Medigap plan. So there are no referrals. You have freedom to choose doctors. Generally, you'll be covered anywhere in the United States with your Medigap plan. So if you're in Florida and you know there's a dermatologist there that you really want to see, he or she's the best in the country, you can use the Medigap plan for that purpose while you're out of state. Excuse me. There are some routine services, though, that the Medigap plans do not cover, and the reason they don't cover them is because Medicare doesn't cover them. So, for instance, the routine vision and hearing exam is not covered by Medicare. So when I say routine, it's more, just a hearing exam, or when you go to the eye doctor and you have to read the eye chart, that sort of thing is not covered by Medicare. one or two of the Medigap plans will add riders on that will allow you to pay a little extra money and get it covered. Others do not. The other thing that's not covered, this is a little harder, I think, for us to see now, but is the annual physical exam. So Medicare covers a wellness exam, and that's a visit that you have to the doctor once a year, and they're just saying, how are you doing, looking at the meds you're taking, and that sort of thing. But they don't cover the kind of physical where, I think they're kind of an olden days thing in a way, but where you used to go and they used to take a whole raft of lab tests, even though you didn't have an issue. They were just checking on your health. They do not cover, these plans do not cover that. Going to the other side, for the Medicare Advantage plans, generally, as I mentioned before, their premiums are lower, and there will be some Medicare Advantage plans with 0 monthly premium, and then they will go up at different levels. Generally, with HMOs, at least with the Medicare HMOs, you are restricted to a network. So you would have to choose a primary care provider. The primary care provider must be in that network, and that primary care provider would handle your referrals to specialists should you need specialists. They, outside the area though, I think there are two things that are a little different here. Most of the Medicare Advantage plans will give you coverage outside the area or outside the network for two reasons. One is an emergency situation. So if you have a heart attack in North Carolina, you go, you go and get whatever services you can get there. If you're out of the area and you have an urgent situation, maybe strep throat, UTI, or something like that, something unforeseen, again, you can go and get treated where you need to be treated. There will be a copay for those things. There'll be an emergency room copay. There'll be an emergency area copay. The HMOs may include extra benefits, and I think this is what we're seeing a lot of advertising about now. So some of the, not just the HMOs, the Medicare Advantage plans in general, might offer a routine vision exam. They might offer an annual physical. So you'll see things like that with the Medicare Advantage plan. So that's kind of the differences between them. So now getting into the reason we're here, the open enrollment. So the question is, what is Medicare open enrollment? So this is the one time of year where everyone in Medicare can review their coverage, compare their coverage with other coverages, and enroll or disenroll in a plan. So the major changes you can make is enroll and disenroll in a Part C Medicare Advantage plan or in a Part D prescription drug plan. When we talk about Medigap plans, I'll mention those a little bit more. There's some continuous open enrollment there, which we'll talk about. Medicare open enrollment has started now. It began on October 15th, and it ends on December 7th. So you need to make your decisions. If you want to change a plan, you need to make the decision by December 7th. The new plan will take effect on January 1. If you don't want to change your plan, you don't need to do anything right now, anything this year, right? So to be a little bit more specific about what kinds of changes can you make at this time of year. If you're in a Medicare Advantage plan, you can switch to another Medicare Advantage plan. If you want to switch to a Medigap plan and pick up also a Part D Medicare prescription drug plan, you can do that at this time also. If you have a Medigap plan with a Part D plan, you're happy with the Medigap plan, but you want a different drug plan, you can switch, keep your Medigap plan, change to a new drug plan. If you have a Medigap plan, you can also, during open enrollment, switch to another Medigap plan if you want. And you can switch your drug plan too or not switch those. if you have only parts A and B of Medicare, and you don't have anything else right now, you can enroll in a Medicare Advantage plan. You can enroll in a Part D drug plan. You can enroll in a Medigap plan. The issue that you need to understand with that, though, if you don't have a drug plan now, and you could have had one because you're already in Medicare, there may be a penalty for what they call late enrollment in a drug plan. So that's not a reason not to get a drug plan, but you just want to be aware that that's what might happen. Medicare rules will require people to enroll in a drug plan within 60 days of the time they become eligible for the drug plan if they don't have other suitable coverage. So that's where we get into that. Most of you probably aren't going to hit that, so I'm not going to push that too far. These are the kinds of reasons that people are looking at during open enrollment. And I think the biggest reason we see here is people who want to look at their prescription drug costs, because their costs may have gone up a lot. They may have a new drug that they didn't have before, and they want to see if there's another Part D drug plan that will cover the cost of that drug. Also, people might be looking at changes because they have a new diagnosis. That might require, they feel that they might need different specialists. They might want to change to a Medicare Advantage plan that has the specialist they want. They might rather go to a Medigap plan where they know they can get help from any doctor who accepts Medicare. Or the same thing might happen if someone is anticipating surgery and that sort of thing. They may want a different sort of plan. The another, I guess, important reason as I look at this for people to look at it is if you're in a Medicare Advantage plan and your physician or hospital is no longer going to be in that network. Again, that's another reason to look at it and definitely make a plan change. So then the question is, how do you compare plans? So first of all, you would have received by September 30th something called an annual notice of change. And you would have received this from, if you have a Part D drug plan, you would have received it from your Part D drug plan. And that notice would tell you what the new premium is, the new monthly premium is going to be for the plan, and would give you some information about the tiers. Are the cost of their drugs going up? Is a Tier 1 drug going from $2 to $5, for instance? And it might give you some idea about what drugs they might be dropping. I've noticed for some people it said to people specifically, which was interesting, this drug that you're taking now will not be covered next year, that kind of thing. So do look that over, and if you see anything there that concerns you like that, you can certainly always make an appointment with us, because this is what we spend a lot of time doing, is working with people each year, looking at their drug list. And we use, and this is something you can use too, we use on the Medicare website, which is at www.medicare.gov, they have something called a plan finder. And you go into that plan finder, you enter the drugs that you're taking. It will take, right now in Massachusetts in 2023, there are 24 standalone prescription drug plans, in Part D plans. It will take those plans and organize them by what plan is most efficient for you in terms of covering drugs and in terms of cost. So take a look at that yourself if you want. If not, call us and come in and see us, and we'll help you do that. If you do that, it is helpful for you to set up, and you'll notice this when you go into the Medicare site also, it is helpful for you to set up an online Medicare account, because this is an account for you. And when you put your prescription drugs in there, they'll stay in there. So if you look and you say, oh, this plan is the best for me, and then you're thinking, is that really what I want to do? You go back to your account, log into your account, your drugs are still there, and you can fool around and look at other plans that are a possibility for you. The other thing that the Medicare site does, to a certain degree, okay, is it will give you information about the Medicare Advantage plans. It will tell you what's the copay for a primary care, what's the copay for a specialist, what do I have to pay if I'm in the hospital. You will get some reasonable information about that there. I feel it leaves things out a bit too, though. So if you're looking at a Medicare Advantage plan, I would also suggest to you that you go to that plan's website. And there they usually will have charts that will be comparison of benefits, summary of benefits. The other thing that you can do on on those charts is look at, there's a different document called Evidence of Coverage. Now this is long, it's maybe 200 to 300 pages long, I know, but it's there. And if you go to chapter 4 in this document, it has a list of all of the services, like it'll, whatever the service is you're thinking of, and you can look at that, and that will give you an idea of how this plan covers this service. It's this is the Medicare, no, this is, I'm sorry, the Advantage Plan's website. So if you're looking at Blue Cross Blue Shield, you'd go there. I did give you, actually, I'm sorry, I forgot to mention this, but you do have something here that's called Medicare Advantage Plans in Massachusetts, and it will give you the website for each of the companies that write Medicare Advantage plans. Look at it a little bit because it's by county. So not every plan is offered in Middlesex County. But then you can get in to see all their plans, and a lot of companies will have 3 to 5 plans, 3 to 5 different plans. So it gives you a way to compare that. Again, for this, you can always come and talk to us. We're happy to talk to you about it. On a Medicare Advantage plan, we'll be doing exactly this, though. We'll be going into the website, showing you the website, and talking about what's there, all right? So now I'm going to talk a little bit more specifically about Medicare Advantage plans. So the first thing I think we always tell people about a Medicare Advantage plan is check and make sure your doctors and hospitals accept the plans and make sure that the drugs are covered. So it's easy to see if the drugs are covered by using the plan finder. That will be clear. In the plan's websites, they'll all have a little spot that says doctor search, provider search, something like that. You click on that, you put the name of your doctor, you put the name of your hospital. You probably will have, in some cases, you'll have to put the name of the exact plan you're looking for. Is it an HMO, is it a PPO? But it will come up and tell you if the doctor accepts the plan. You can also call the doctor's office to see if they accept the plan. I think it's a little care you'd have to take with that. You may want to talk to the billing office because they may know better. But because, like a company like Blue Cross or Tufts, they'll have plans for people in Medicare, they'll have plans on employer group plans, they'll have plans for people through the Health Connector. So you have to be specific about what plan you're talking about and make sure the doctor's office says that. And so we talked about it. You might want to do a little bit of comparison between the Medicare Advantage plans. What are the premiums? As I mentioned, some are zero premium, some are $200 a month premium. What are the co-pays? What is the annual out-of-pocket maximum? What the annual out-of-pocket maximum is if you had a bad medical year and you were paying a lot of co-pays, you were in the hospital several times, you had a lot of per day pays, then once you reach that out-of-pocket maximum, the plan would pay 100% for the rest of the year, so you wouldn't have co-pays for the rest of the year. I think in looking at the plans this year, the out-of-pocket maximum seemed to go from about $3,400 a year to $12,500 a year. So of course, in general, the higher the premium, the lower that out-of-pocket maximum is going to be. There are, and we mentioned before, some of those plans have extra benefits, so you may want to take a look at that. I'm going to talk a little bit later about the Part B drugs, et cetera. One thing about the out-of-pocket, now that I'm looking at this, it's reminding me, your drug costs, whatever you're paying in copays for your drugs, it does not count towards that out-of-pocket maximum. The other two things about cannot enroll and that kind of thing are in the weeds a little bit about enrollment. But if you can't enroll in a Medicare Advantage plan and in a Part D plan at the same time, because Medicare Advantage includes Part D, you're either in a Medicare Advantage plan or a Part D plan. And if you're in a Medicare Advantage plan and you select a Part D plan, it's going to kick you out of the Medicare Advantage plan. So that's what you just need to be careful about. So these are talking about what's new about Medicare Advantage plans in 2023. So there'll be 66 Medicare Advantage plans in Massachusetts in 2023. This covers, I think, about 14 different carriers. I think in Middlesex County, there are about 24 or 25, I think, Medicare Advantage plans. There is one new plan insurer this year, which is Mass General Brigham Healthcare, and they are offering 3 Medicare Advantage plans, and they are available in Middlesex County. There are 2 plans that are offering, and this is something kind of new, they're offering what they call a Part B premium reduction, which is also known as a give back benefit. So those plans will reimburse you part of your Medicare Part B premium. Now your Medicare Part B premium is being deducted from your Social Security check. But I think then they will give you back, I think it's $35 to $65 every month of that premium in those plans. There is another change, too, for the Medicare Advantage plans, but for all prescription drugs, and that is insulins will be covered now at a copay of $35 or less. This is as a result of the Inflation Reduction Act, that law that went into effect very recently. And it will not require that you meet an annual deductible. So the most you would be paying for insulin is $35. Now, this is assuming that your plan covers the insulin. So again, this is where you have to go into the plan finder, load all the drugs. Is your insulin covered? And if it's covered, that's good news. There's one piece of funny news here. Because this law was passed after all these drug plans were set up, they were not able to change it. So what we have to do then is, let's say, I dealt with someone the other day, so I kind of could see how it works. They had an insulin cost of 2 insulin drugs, one at $1,200 and one at $1,400 when we did their plan. This is for the year, okay? But when we did their plan setup. So what we did is we had to pull those out, take 35 times 12 for both, and add it in so they could get an estimate of what their cost was. It's doable. But you just need to know it. But you do need to make sure that your plan does cover it. The other thing, and this is a thing I guess that's changing with some Medicare Advantage plans this year too, is they're instituting something that they call Part B step therapy. Now let's talk a little bit to get more confused now about what Part B is. There are some drugs that are covered by Part B of Medicare, not Part D. And these are drugs that a medical provider has to give you in a medical setting. So I think it's, infusion therapy maybe, some of the osteoporosis drugs, I think some of the allergens, that kind of thing. So if you have a drug like that, then the Medicare Advantage plans will tell you how they pay for it. Typically, they'll pay 80% and you pay 20% for that. But they may require that before they agree to cover it, and this is where the step comes in, they may say that they want you to try a different Part D drug or a different Part B drug. And so they may require authorization or some information for your doctor on that. This doesn't apply to existing treatment, but it will apply to new treatment in 2023. I think the last thing I'll mention in the world of Medicare Advantage is there is also something new on the horizon. This was here last year too, and it's called a Medicare Medical Savings Account. And this is considered to be a Medicare Advantage plan. And this is very similar to if we worked, some of us had health savings accounts where we would put some money into an account on a pre-tax basis. This is what this is. So it's requiring that if you're a member of this, you make a deposit in the plan. And then you'll have a rather high deductible. And once you've spent that deductible, the plan will cover you. I do not know much more about that than this. So I'm going to say the reason we have the Lasso Healthcare here is that's the company in Massachusetts that writes these plans. And so I'd suggest you, if you're interested, go on their website and give them a call to find out more information about that. Here we get into some more Medicare language called 5-star SEPs. A STEP stands for Special Enrollment. What? Special Enrollment something, period. Stands for Special Enrollment, period. So if a plan has 5 stars, it means that someone can enroll in that plan sometime during the plan year. You don't have to wait until open enrollment to do it. In Massachusetts, the only plan that has 5 stars are the Tufts Medicare Preferred HMOs. And there are no Part D prescription drug plans that have that. And the Tufts PPO, which is a new plan for them, does not have that either. So I'm done with Medicare Advantage. Do you have questions about that? So now I'm going to talk about the Part D plans. So these are the Medicare prescription drug plans. And there are 24 plans available in Massachusetts in 2023. And you have the list of those on this manila sheet. Now again, this lists the 24 plans. And I guess it's helpful, but really, when you get to drug plans, what you need to know is what plan covers the drugs I take. And you're not going to see this here because you need to go into the plan finder to look for that. So I would still say always use the plan finder, but this gives you a little idea of what the plans look like, what their various costs are, and that sort of thing. There are 4 plans this year that have a 0 deductible. There are 13 plans that do not apply the deductible to all tiers, which is nice because if you have tier 1, tier 2 drugs perhaps, and the plan you're in doesn't make you pay the deductible first. You'll just get your drug at whatever the copay is for the plan. Some of the notable changes, again, for the standalone prescription drug plans are the same thing. The insulin is covered, as we mentioned before, with the drug benefit under the Part C plans. There are 4 new plans in Massachusetts. This is a list of those plans. One of the plans, every year some plan decides to change its name, sometimes more than one. This year, fortunately, just one. But the SilverScript Smart RX is changing its name to SilverScript Smart Saver. And that is still the least expensive plan, premium-wise, in Massachusetts, of $6.80 a month. The Cigna Essential RX plan will be discontinued. And what Medicare uses this term crosswalked. So that means that the plan will take anybody who had that plan and automatically enroll them in the Cigna Extra RX. Now this to me is where somebody, if your plan is doing this, this is somebody that wants to go into that plan finder or come and see us and talk to us, because look at the difference in premium. You know, the premium is almost doubling. And you may well not need to pay that much premium to get your drugs covered. So this is something, definitely look at this. There's also another plan that has a significant price increase, and that's the Elixir RX Plus. So again, if that's where you are. You might want to take a look at that or come in and see us, and let's take a look and see if there's not something that would be more cost effective for you. There is preferred pharmacy pricing. I have to apologize to some of you for some of these slides too. I had to copy them myself, and my printer was going down a little bit, but I think you can read through it. So preferred pharmacies pricing is each plan will have some kind of agreement with a pharmacy that this is maybe where you will get the best price. So when you're in the plan finder, there's room to put 5 pharmacies in there. I don't know if you need to put 5, but you might want to put 3. You know, when I do it for somebody in Winchester, I always put the 3 pharmacies that are in Winchester in there so we can see, is there a difference in what your copay will be for the pharmacies in the area. And so, but then as it says, you know, so you'll think, oh good, there's preferred pharmacy pricing, but then you look at the price, and sometimes the preferred price is not the best price, so just be aware. But do look at more. I think the point is, do look at more than one pharmacy. And so I'm done with that part too. Any questions? Where you really get the shock, though, is if the pharmacy is out of network for the plan. So I was doing one last night for somebody, and we put in 3 pharmacies, so that was fine. And this was not in Lexington. This was actually in New Hampshire. I was doing for my sister. But we put in the 3 pharmacies. And one of the pharmacies, she had a rather expensive drug. One of the pharmacies did not cover it at all. So her drug total was $60,000 for the year. So I said, you won't be going to that pharmacy. So you don't always see something as dramatic as that, you know. But yeah, so take a look at it. Yeah, shop around. Often you'll see, often you'll see a minor difference between CVS and Walgreens, for instance. And, you know, I would always look at Winchester Pharmacy because sometimes that does very well. And the other thing that's very nice for people with Winchester Pharmacy is they deliver at home. So there are certain people that's really important, and that works well for them. Yes. And sometimes mail order is less, and sometimes it's not. Again, you can put mail order in the plan finder so you can see that. Okay. So now I'm moving on to Medigap plans, and those are described, as I think I mentioned before, on your blue sheet, which is here. And there are 3 Medigap plan designs. One of them, which is called the Supplement 1, many people will have the Blue Cross Blue Shield MedX Bronze, which is the Supplement 1. This is available only to people who were 65 before January 1st, 2020. So it's not on the market anymore unless you deferred enrollment. You know, you're 70 now, you're still working, you deferred enrollment. That would be available to you. The Supplement 1A is available to all eligible Medicare beneficiaries. The core is also. On the next slide, I think this is a little bit different way of looking at the back of this Medigap sheet. And so what this is telling us is if you had Part A and Part B of Medicare and no Medigap plan, then if you were in the hospital, you would have that $1,600 deductible per benefit period. You would have the Part B deductible of $226, so that's your doctor's bills, that's your calendar year deductible. You would have a doctor copay of 20% for every visit you made for whatever. And if you were in skilled nursing 21 to 100 days, you would pay $200 a day per day. If you had the core plan, you would pay, you would still be responsible for that $1,600 deductible. You would still be responsible for the Part B doctor deductible. You would not be responsible for the 20% copay, 20% coinsurance. You would still be responsible for the $200 a day skilled nursing. You would have a monthly a monthly premium for this, and the premium would range. I think the numbers they put in here is the range of the premium from if you go under the core plan. Yeah, it's the range of the premium from 170 to 216, depending upon what plan, what company you select. With the supplement 1A, you can see your out-of-pocket cost would be $226. And with the supplement 1, you would not have any out-of-pocket costs with this. These plans do have something that is continuous open enrollment. So this is the only time you will hear about anything in Medicare that has continuous open enrollment. So if you were in one of these plans and you decided, let's say you were in the core plan and you thought, I have a hospital admission, I have scheduled surgery coming up in 2 months, you could call the plan provider and you could move to the supplement 1A. So you're going to pay more money during that time period, but you could stay in the supplement 1A until such time your bills were out. You could call back and go back to the core. No. What? Thank you, Sumner. The question was, I forgot. I was supposed to be repeating questions and I forgot. The question was, do you have to disclose if you're doing that? And the answer is no. However, you do have to do it before the first of the month. So of any month. So you would need to call them before the first of the month. So my caution with this is, this works well if you have scheduled surgery. It's not going to work if you have an emergency and you end up in the hospital on the 16th of the month. You're not going to be able to get that changed retroactively to the first of the month. So I say to people, know about this, but also remember you need to make the change for a scheduled surgery. And people will come to me and say, Judy, I forgot. So that's just the thing to know about that. Yes, it's a good question. If you have a supplement 1 now, you drop that, you go into a Medicare Advantage plan. Can you go back to the supplement 1? Right? The answer to that is yes. And the answer to that is yes at 2 times, now that I think about it. If you have a Medicare Advantage plan on January 1, so should you change now for January 1? Okay, so let's say you drop a supplement, you go to a Medicare Advantage plan for January 1. Believe it or not, there's another open enrollment. And that open enrollment is for people in Medicare Advantage plans only. And that goes from January 1st to March 31st. So you could change back to the Medigap plan as early as February 1st if you wanted to. So that's one time you can do it. And then the other time you could do it would be at, let me just think through that. Yeah, and you can pick up a Part D plan then, I'm thinking. And the other time you could do it as open enrollment at this time of year, at the regular open enrollment. There's no penalty for late enrollment in this kind of plan. There is a penalty for late enrollment in Part B of Medicare, but not with this, no. And then the last couple slides are talking about some Medicare savings plans, programs. There are some programs that help people below certain income and asset levels pay for some of their Medicare coverage. It might be to pay for prescription drugs. It might be to pay your Part B premium. It might be to pay your Medicare copays. 2 of those are cited here. If you're interested in that, we do have some other literature. I don't have a lot of copies here, but I can get them to you. Concerned about Medicare costs that will tell you some other programs you might want to look at. You can also come and see us because we'll help you through that. And the other thing we have is the Prescription Advantage plan. And this is a Massachusetts plan. I suspect some of you may already have this, but this is a Massachusetts plan that does 2 things. One, it helps people again, under certain income levels, pay for their prescription drugs if they have expensive drugs. So you pay for your drug first. As time goes on, if you pay a certain amount, this plan will kick in and reduce the copays for you. The other thing that it does is anybody who's a member gets one open enrollment outside of the regular open enrollment, one time that they can change their drug plan during the year. So, you know, if it comes to June and you just don't like the drug plan you have, or you don't like the Medicare Advantage plan you have, if you have Prescription Advantage, that gives you another chance to get out of what you have, because you can either go to a Medigap plan plus a new drug plan or a different Medicare Advantage plan. So we do suggest that anybody who can be eligible for it, we do suggest you get it. There's you have the website for it here. We can help you with that also. If your income is over a certain amount of money, and then under a certain amount of money, you can enroll also, but there's a $200 annual fee for it. If you're going to come and see us, we do ask that you bring some information with you. One, your Medicare card, your present health cards, what else do we need? If you can sign up for a Medicare account, set up your Medicare account, that's helpful, do it. If not, we'll help you do it if you don't have one. And some of these other things we need to know, and unfortunately once in a while I think I forget to ask people this, but some people have plans through their employer, have retiree health plans through their employer. We would need to know that. Some people use veterans benefits or have the federal benefits. So again, it helps us to know all that kind of information. These are some more slides just of various places that you can call for help. But I think I'm done. Any questions at all? The question is, what's the time to enroll in Medicare? It is, you have what they call an initial enrollment period. So that's 3 months. I don't know what did you say 60 days? It starts 90, yeah. So it's 90 days before. So if your birth date were January 5th, let's say, your Medicare start date is January 1. It's always the first of your birth month. So you have 3 months before and 3 months after. So you have a total of 7 months. 3 months before, birth date month, 3 months after. There are some, and if you do it before, then your Medicare start date is going to be January 1. All right? If you do it after, and this is where there's a change in the law for 2023, and it used to be if you did it after, then your start date wasn't for a couple months. I will have to check, but I think I have it written down here, but I think now you can get your effective date becomes the month after you enroll. But I need to look at that because I don't quite remember. I was going to say that next. You would go to the desk here, to the reception desk, and they'll set up an appointment for you. Because we'll be here. So, yeah. So Monday afternoon, Pat's here Monday afternoon. Sumner and I are both here Thursday afternoons. And I'm here Friday afternoon. Only during open enrollment. But you know what? You better do it now because it looked a little full. Yeah, okay. She would be able to take an advantage of a Medicare Advantage plan here. And I think she has 2 months from the time she moves to do that. I think, but remind me to check that for you too. Yeah. So she's talking about a drug that the plan didn't take initially, and now, and this does happen, and now probably your doctor's office appealed it, and the plan said, okay, we'll cover it for you. I just would want anybody who is going to travel, who's in a Medicare Advantage plan, who's going to travel outside the country, to talk to the plan and confirm that they're going to cover you. And I think what might happen, as you say, is you might have to pay and they'll reimburse you. Yeah. But just make sure you understand that whole mechanism.